notice that they're going to have a couple of talks going over
533?
their back to school testing for their coordination and
I'm sorry.
Okay. So they do have a sign up where you can sign up for one of these 2 talks to go over
What time is
getting COVID tests and doing those tests and getting home test kits for the backpack program. So the link for the sign up is here in the talk if you didn't happen to get that announcement or maybe kind of lost it in the pile of emails you get. This is just a nice article that we got over the summer talking about ways you can use your COVID funding to help with air quality. Just because we have found, studies have found that improving your air filtration or your HVAC systems can really improve reduction of illness overall. They focus on COVID, of course, but just any other illness as well. And you can use your COVID money for that. So I know a lot of you don't have air conditioning even, but need to do a lot of repairs or updates on that. So you can use your COVID funding for that. This is a tool. This link is also in the guidance documents that we sent out this week. But this is a nice calculator that you can put in your community rates of COVID and the size of your school district. And it will tell you approximately how many cases of COVID you'll probably see in your school population. And then just based on masking rates in your school, whether people are wearing masks or not, how many secondary cases to expect in your school, and then how many cases that will then lead to in your community. So it's just another resource available to you to use. It just makes interpreting what those numbers are easier to actually mean something for you. So the documents that we sent this week, there's really no new recommendations. Nothing new is in them. They're just kind of put together a little differently, hopefully a little easier to understand, a little more useful is the hope. But there really is nothing new or different from the end of last year. My hope was to try to incorporate COVID kind of in with the rest of infectious disease prevention and response, since this is really just going to be part of everyday life from here on out. The first document, let me see if I can, will look like this. We'll say pre-K through 12 public health guidance for 2022 to 23. I did try to bundle in preschool and daycare into this, trying to make it a little more easy. So the beginning basically states that we're transitioning from a pandemic emergency response more to just a standard approach where we're responding to COVID like we would other respiratory illnesses like influenza. If things change, the levels of COVID change, there's a new variant, things might have to change. But our focus should really go on basic prevention of illness and trying to identify when clusters or outbreaks might be happening and responding to that, and not relying on things like individual case investigation and contact tracing, that more labor-intensive approach. So that's just kind of the basic. In that document, I have 10 basic recommendations. Under each one, I guess there's 9. I'm sorry. I was down to the wire getting this ready for you guys, so I put a lot in about monkeypox here at the end. So there are these basic public health recommendations that are in here. There's a lot more in there to go through, things to think about and consider and resources, but the basic guidelines here are to have 6 students and staff stay home. There is an illness guide that I put together for you that you can use with parents if you would like to. The second one is just to report appropriate information to the health department. There are some legal requirements behind that, and that's all explained. There's some guidance about requesting information from parents and staff about illnesses, which will help you to then report to us appropriately, but also to help you identify when something might be coming so that you can better respond and keep your illness numbers down and hopefully keep your school open. Monitor community conditions and respond accordingly. At the end of the document, there's a section to help you then use those numbers to make decisions or adjustments, and I'll go over that in a few slides. Incorporate COVID testing into your response plan. Here's where that number 9 came in. Number 10 is, and I apologize, like I said, I was editing this right up to the wire. Number 6 is watch closely for signs of illness, clusters, and outbreaks. Number 7 is respond appropriately to clusters and outbreaks. Number 8 is school closures should be a last resort. Number 9 is be prepared to support students, families, and educators during illnesses and closures. And number 10 is have a communication plan. And then I do have a separate document that has resources for that. So these are all recommendations for you to consider. So the parent illness guide, showing it to you larger, looks like this. It's something you can give to parents. You can add, it is a Word document. You can add in your phone number here for them to call. It goes over COVID more specifically as to what they should do if their child has symptoms. For exposure to COVID, they can continue to come to school wearing a mask, and there is testing recommended after 3 to 5 days. And then there's recommendations here for if they test negative for COVID or if they have another illness, when they can return to school after that event. One of my astute nurses noticed I had a typo in here. Down here it says, if your child tests positive for COVID, tell your child's school, there's a word of in there. Again, it's a Word document, you can take that out, but I will correct it and you'll get sent corrected versions of it and they will be put on their website. So again, things have been a little bit hectic lately with monkeypox, so I apologize for the last minute corrections. The other thing we included to help with number 3, which is requesting information from parents and staff. This again is just a resource. It's nothing you have to use, and you may already have something like this already put together. But for those who don't, as you have parents calling in sick with sick kids, it's just a way for your staff to keep track of what people are calling in sick with. You can identify if there's a trend, like, gosh, we're seeing a lot of sore throats, we're seeing a lot of strep, we're seeing a lot of, X, Y, or Z, so that you can identify if there is something happening so that you can, make decisions about cleaning or other modifications or other things you can do to try to stop outbreaks from getting worse. So again, this is just for your use to help with your tracking and identification of issues. The communication tools document, it looks like this. It just has some links on it to different resources that others have put together. I also pulled some letters for parents on other illnesses, and we're happy to help you edit these and put them on our letterhead if you would prefer. And then on the following pages are some sample letters. One is for parents to instruct them on the isolation guidance if their child does have COVID, and then just a general notification letter if there is someone in a classroom or in a school that has COVID, just a general notification for others in the school. So that is what the communication guidance is. At the end of the general document that goes over the recommendations, I added in something that is based off of something I found from Connecticut. It's just considerations for the administration regarding any policy changes for infection control, which could include mask use, but could include other things like using HEPA filters or other prevention measures. So things might be, looking at the available community and district prevalence, and that's where that calculator comes in. I put the link to that there, and within each of these categories, I put several links and several resources to help support these questions for you to think through. What's the risk tolerance for your staff and students in your community? What's the vaccination status for your staff and students, not only for COVID, but if you have an influenza outbreak going on, for that as well. What more planning might be necessary if you have students or staff with high risk for adverse outcomes. What added guidance might be necessary to help staff or students who might wish to continue wearing a mask, and what processes do you need to have in place to continue with risk assessment and prompt decision making. So again, just some things with, again, in this document, many resources and other bullet points to help you think through those things from the get-go, or if things do happen to get worse. So these are the things that are still available on the state website. The state does plan to come up with some new documents more to just summarize guidance and to provide more resources, but there are no plans for any updates or changes to what guidance there is. They have told us that they're probably, regardless of whatever happens, there will not be any orders or mandates or anything like that. So I just put all the links that are on the state website for schools and COVID on here, just so you have them available, but they're all on this main page. They still have this infographic available. Our guidelines, for the most part, follow this. I suggest testing 3 to 5 days after exposure. They say 3 to 7. It really doesn't matter that much. But again, this infographic can be utilized. I didn't make a new one because, again, it's essentially the same as what our guidance is. This is the same as they had last spring near the end of the school year. So just real quickly, the most recent data, which was near the end of July, I just wanted to share this primarily because this is a new data set they have available. The website is here, but you can also get through it on the same web page where they post other data sets that they have. But this is a new one where they're posting cases of individuals ages 5 to 18 based on their address. So they may not necessarily go to that school district, but they live in that school district. It's really the best they can do because they don't necessarily know where a kiddo goes to school. But they're showing here how many kids in that ISD area have COVID. So as you can see, some of these more southeastern students, there's some additional cases there. But for the rest of Michigan, the case rate in the 5 to 18-year-olds are pretty low. The issue with all of the data I'm going to show you is it's pretty much only for people that have tested positive by a PCR test. Home testing will never show up on this data, and only confirmed testing is usually included in this data, and a confirmed case, a confirmed test is a PCR test. So antigen testing as a whole does not count into this. So most of our data is going to be falsely low. So again, it gives us an idea, but it's very much on the low side. They have another tab where they give the actual school districts in addition to the ISD. So again, pretty low rates for the 5 to 18-year-olds. But again, my hunch is that of those that are getting tested, it's by antigen test. They also, on their main page, just the main coronavirus page, have the community levels like the CDC uses, which takes into account positivity, case rate, and hospital utilization. So most of our area is in the low, some of us are in medium, and then one of our counties is high. When I say our, realize that I'm talking to 19 counties right now. They also have cases per 100,000 averaged over 7 days. So it's a daily averaged over 7 days. So again, for the most part, still averaging on the lower end. Actually, I think I'm sorry, this is a 7-day average. So this is over a week. So 7 days total. So we do have some areas that are getting a little bit higher. Typically we have been seeing increases, and usually we do see this pattern where it tends to kind of creep up from the south. So I did include some slides from last week's modeling update and then some from this week. As you recall, this is a report that's put out each week by the state of Michigan and does give a lot of good information. This slide I did borrow from one of our epidemiologists just to give a look at how the community levels have been increasing over the last month. And again, just kind of creeping up from the south and coming up north. The cases are increasing, so here is our curve of cases on the bottom. On the top is the reproduction number, so that's how many people are getting infected from each case, and once it goes over 1, that means we're going to see increases in numbers, because if you get more than 1 case from each person, then it's going to increase. So again, things are just slowly increasing. The dark purple counties are counties where the rates are suggesting that the case counts are increasing. This is kind of small, but the top is the percent positivity. Again, that's of PCR tests. The daily cases per million is here, and that's the daily cases. So again, just kind of a gradual increase. Hospitalizations have slowly been trending up, but pretty steady. And then the deaths have continued to go down, which is a good thing. So the highest number of cases or the highest rate of illness is in the 30 to 39-year-old individuals. Our kiddos are still pretty low, but we tend to see that change as school starts, but hopefully that won't occur this year. So the variants, as you can see in the United States, the biggest variant we have is the B5 variant of Omicron. Over here from Michigan, I tried to enlarge it because it's pretty hard to see, but light blue is B5, so the majority of variant testing in Michigan is B5. Brown is BA4, so those two are kind of the most of our variants. BA2121 is the neon green, so it's just basically a mixture of different Omicron variants, kind of like we see in the US. But just in case you're interested there. So the hospitalization trends, again, kind of gradually increasing, but hopefully leveling off, and our ICU use for COVID has been pretty stable. So severe illness has continued to be less of an issue. The state child hospitalization rate has continued to bounce around, and unfortunately has never been 0. So this is just showing our different surges over time. So the brown line is our summertime for the last few years. We're at year 3 now for summer. And then going into fall, we usually do see a surge. So, that's kind of the concern, is that we will see a surge into the fall, but nobody really knows for sure. We are slightly above hospitalizations for where we were this time last year. And then, certainly we all have concerns that the vaccine we're seeing some more breakthrough with the new Omicron variant. It still does reduce your risks. In June, the cases they saw, those that were fully vaccinated were less. You had 2.5 times more chance of getting infected if you were not vaccinated, and 28 times more chance of dying when they looked at the data in May. So again, you're still at better odds if you're fully vaccinated, but we do know that we are losing some protection there. So I know monkeypox has been a topic of concern, so I'm just going to go through this quickly, but I want you to have some materials here. It's been a rare illness. It can be severe. Typically it starts with flu-like symptoms and then swelling of lymph nodes and then a rash. But with this outbreak, some people have a rash before those other symptoms occur. It's related to smallpox, but not as severe as smallpox. The rash can last 2 to 4 weeks. Traditionally, it usually would spread from animals to people and then could go person to person. This one has been primarily person to person. It can be spread through direct contact with the rash, contact with clothing or bedding or towels or other items that someone with the illness or rash has had a lot of contact with, prolonged face-to-face contact, therefore having contact with respiratory secretions, but that takes quite a long time of exposure to that. And then during intimate contact, which is due to the close skin-to-skin contact or contact with bedding and clothing, it is not considered a sexually transmitted infection in and of itself. It's more due to the skin-to-skin and close contact otherwise. So this is just an image of kind of a transition of what the rash goes through. It can just be a spot that goes into a blister and like a pustule after that. It can be painful or itchy. It really will be wherever the exposure took place and then can spread. It can spread to other people until the lesions have scabbed and fallen off and new, fresh, healthy skin has formed. It can last up to 4 weeks, and it typically resolves without issue, without treatment, although it can be uncomfortable. Rates have increased since I made this slide. This was on the 2nd, and what did I put? I guess I didn't put Michigan numbers. As of this morning in Michigan, we have 66 cases. Yesterday, there were 55, so they gradually do increase. Of the counties on this call, we've only had one county with 1 case, and that was Montcalm County. But given how quickly this is increasing, we do expect, more cases to occur. Worldwide, there's 25,000 cases in 344 countries, and the U.S. Has the highest number of cases. We are working on vaccination efforts of people who have been exposed or have been at high risk for exposure. There have been very few cases in children. In the U.S., it's been confirmed that there have been 5 cases. Primarily household contacts to people with monkeypox, and that really is the main risk to children at this point. So it would be extremely, extremely unlikely that you would have just a random person, a student with monkeypox. If there were someone who was identified with monkeypox, then we would investigate that case and we would keep close contacts home in quarantine. So if you have students at school with a rash, this would be the least likely thing to be worried about. In the guidelines, in that handout for parents, there's a section that states any rash with fever should be checked by a healthcare provider, and they can return once the rash has been diagnosed and known to not be contagious, is treated, or has healed. So that guidance really for your staff and students is sufficient. Just basic good guidance for everything right now and any other rash or illness is just to avoid close contact and don't share objects with people who are sick or have a rash. And so, don't, if they're sick and have a rash, don't hug, kiss, or touch, don't share things, don't share clothing, and then wash your hands often, don't touch your eyes, nose, or mouth, things like that. So just basic guidelines. I did include some links to some good educational information, one that's specifically for parents, so that you have that available. The main ask is just be careful with messaging. There's certain sexual activity right now that seems to be particularly high risk for transmission, and stigmatization is a big concern. If you hear stigmatizing speech, in your schools, try to highlight that monkeypox can affect anyone, and the virus is what's making people sick, not certain activities. If you have any questions or concerns, whether they're general or specific, please let us know and we'll help you out. And if we know of any potential exposures that have occurred in your school throughout a case investigation, we will let you know, just like if we were investigating other illnesses like meningitis or anything else. So that is what I have for today. I know that that was a lot of information. So I will stop sharing my screen here and we'll open it up for questions. I forgot to remind everybody to put questions in the chat. But if you have questions, you can put them in the chat. And if you don't have access to that, then at the end, we'll open it up to questions by phone. So one question I think Nick might have answered already. We will be sending out the slides and the video to our mail list. But we'll also post them on our website like we did last year. And then with reporting, I have in the guidance document that we sent out, there's a link to the list of communicable diseases that should be reported. COVID is still on the list of reportable illnesses. So if you are notified of a case of COVID in a student or a staff member, you do still need to report that to us technically within 24 hours. You can talk with your county communicable disease nurse to determine the easiest way for you guys to manage that. If you're doing testing through the state with their antigen test, they have an online portal that you can report those positives. The definition of an outbreak or cluster is defined in the handout that we sent to you. I will pull it up right now. So just keep in mind that that is meant mainly for our purposes to help us with reporting. When you take action is not necessarily based on that definition. So this is the document we sent out. School-based COVID-19 definitions are right here on page 5. I'm not going to read it just because it is like reading, instructions to build a cabinet or something. But again, this is what we use to make reporting happen, to help define things. But really, for you, it's more, did we have 3 new cases just pop up on the baseball team? Or are we seeing a whole bunch of new cases that just seems really odd? So it's more what you see happening, and does it seem odd, or does it seem like it's related to spread within your school? The things you want to take action on or talk with us about doesn't necessarily have to do with a definition, but more with what's happening. Are we required to have the COVID numbers listed for our school? Are we required to contact, trace, and notify of an exposure? So the order that required you to post those numbers online was rescinded. So you don't need to do that anymore. And again, schools are not expected to contact trace. It is suggested that if there has been an exposure in your school, that you do a general notification. So let's say you had a case in your 3rd grade class, that you send a letter to the family, just like you would if there was a chicken pox or something like that. And again, that letter, an example letter, is in the communication guide, just saying, oh, by the way, there's been a case, and here's some things you can watch for in your child, and you might want to consider testing. But rather than trying to identify exactly who could have been exposed, you're just letting that whole classroom know that there's been a case in that classroom, so that parents can do as they wish. Reasoning for that is that if there's a kiddo in that classroom whose mom is on chemo, or there's a child in that classroom who has some other health issues, then families are able to make decisions based on what they feel is best for them. And again, that is explained in the paperwork we sent out. So, but it's not, none of that's required, that's just recommendations. Any other questions? All right. So my thinking, especially since we don't have a lot of questions today, my thinking was to hold meetings as needed. So if, heaven forbid, there's some new horrible variant that's taking over and we need to talk about things, we can pull together a meeting, but to not hold regular meetings. However, I'm happy to do things however you want, but I don't know if anyone has an opinion on that. Trying to let you guys get back to life, a more routine life where this is hopefully just part of your routine rather than making you have a lot of meetings. Okay, great. And on the last slide is my contact info, my cell and email, and our health officer's contact info. And I think you all know how to get a hold of us. So again, our county nurses and then ourselves, if you need anything, just let us know. And if we get things that we think you should have or would benefit from, we will forward it to your contact person. If that person ever changes, please let your point of contact at the health department know. All right. Well, again, if there's no other questions, then I will make those few corrections that I missed on my slides, and we will get those out to you with the recording. And again, I'll resend all of the documents that we talked about today just to make sure you have them, and everything will get posted on our website as well. So good luck these last few weeks getting ready. Have a great school year. And again, if you need anything, let us know.
Okay. Thank you.
Yeah, thanks.